So the U.S. FDA has already set aside 3 days in December 8th, 9th, and 10th to really look at the data, the Pfizer vaccine data, which of course we know is more than 90%, 95% efficacious from the press releases and from the studies. But we expect the Moderna will probably submit the application then as well. About right after they approve it, we expect it to go to healthcare workers. It will be distributed. There'll be a delay maybe of a few days. But then each hospital will have a priority system. Probably won't get into the arms of most Americans until late spring, early summer, depending on how many other vaccine companies release data. That means that for most of winter, most people in the US still would not be vaccinated.
Okay, that's interesting. Were you disappointed by the fact that AstraZeneca didn't meet the mark in terms of the kind of expectation that was riding on this vaccine trial, on this vaccine candidate, till the third vaccine trial results came out from the majors? What does the story look like here for AstraZeneca?
Well, we had a lot of hopes riding on AstraZeneca. It was cheaper. It could be stored in regular refrigeration and not negative 70 degrees Celsius. But again, I think it's not that I'm tempered with enthusiasm. I think there has not been as much transparency with AstraZeneca as with the other two trials. You know, there was the issue of the half dose, which didn't make sense that it was more efficacious than the full dose. There were issues with, maybe giving a different dose and issues with distribution plans. So I think there are more questions. I think if these questions have been answered, I would probably then reevaluate the data.
And Peter, as we wait with this transition of power ongoing for President-elect Joe Biden's administration to begin, he's quickly assembled a COVID task force. But what kind of action would you like to see at a federal level and quickly?
So, Rosanna, I would like to see really two main things. One is a national strategy, just like you've had in many parts of Asia, Singapore, Taiwan, one singular voice, alignment of science and politics, and then we all move as one instead of 50 different countries.
Okay, and what does that mean for effective distribution of the vaccines, as also really bringing down the curve in some of the major economies that are grappling with a second potential third wave?
Well, I think that, again, much of the rest of the world we need to really figure out a way of distributing vaccines effectively and equitably. Of course, there's COVAX with the WHO backing, and many other countries, notably absent is the US. I hope the US can join into COVAX early in the year with the new administration. The vaccine has to be cheap. There are issues with refrigeration. Above all, the virus doesn't know any borders, so that unless we treat it as a global problem, we'll continue to have hotspots around the world, which makes very little sense if we're thinking about the economy and people's health.